Good afternoon. County Executive Rich Fitzgerald with Dr. Deborah Bogan from the Allegheny County Health Department here to do our weekly briefing on COVID-19, the coronavirus pandemic. And Dr. Bogan will be giving the report for what we've seen for most of October. We've seen a lot of nationally and statewide as we've started to see some numbers go up again. We haven't seen it as dramatically here, but they are going up, and she will give that report. The one thing that we have learned over these last 7+ months is operations can continue and can continue in a somewhat normal fashion if people are cooperating, if people are wearing their masks, physically distant, socially distant is often the case, but we use physically, and Dr. Bogan's right, we want to be socially connected, washing the hands and doing the things we know we can do. And we've seen great success in many operations, business, offices, manufacturing, construction, real estate, retail, et cetera, et cetera. And we also know that the operations in which we get a little more familiar with our family members and friends and our neighbors, we also know what to do, but we don't always do those things. So we really want to encourage people to be vigilant, particularly as the weather gets cold and we're more indoors. We have activities, Halloween, Thanksgiving coming up where people do get together. We want to make sure that the operations we do at work and we do when we go to the store are operations that we do at home by wearing our mask, keeping distant, and not getting too familiar and too close for long periods of time with people that we're familiar with. One of those operations that's coming up and has obviously been in the news is voting in the election that's coming up. This year we've had record numbers of people by mail. Almost 400,000 Allegheny County residents have applied to vote by mail, and I think almost 250,000 have returned their ballots as of today. There's still time, another week till next Tuesday to still apply for the absentee mail-in ballot. You can also go this weekend, at the last weekend that we have the satellite locations around the county, Saturday from 9 to 5 and Sunday from 11 to 7 at these locations. So you still have time to enter. On Election Day, all of the polling places in Allegheny County, the 1,300 and so on polling places will be open. Your neighborhood polling place that you've always voted at will be open. The poll workers will be required to be wearing masks, so they will be there for 13 hours, really doing yeoman's work for this democracy and for our community to be willing to do that. We can't require the voters to wear masks, but we're strongly encouraging that. These are your neighbors. These are folks that are going to be sitting there for 13 hours. So when you do go to vote, if you do feel the need to go vote in person, please follow the instructions, be 6 feet away from the person in front of you, wear your mask, go in and do your civic duty and have your voice heard, but do so safely. There could possibly be poll watchers at the polling place that you're at. Those poll watchers will also be required to be wearing masks. So we want people to participate, but participate safely. Just like every other operation we've seen, from Steeler fans going to games wearing their masks, to people going to school, going to offices, going to the store, our frontline workers, et cetera, where we have learned the things that we need to do. So let's keep cooperating. Let's have a very successful late October and early November as we get into the winter months, because we know that this virus is not going away. It's still very, very serious and very, very deadly, and we need to take it very seriously. So with that, let me turn it over to Dr. Bogan. Dr. Bogan?
Good afternoon, and thank you for joining us. It's been rainy and gloomy the past few days, and so have our numbers. Dr. Levine referred to a fall resurgence of COVID cases across Pennsylvania, and this is also reflected in our numbers right here in Allegheny County. The number of new cases reported each day for the last week is about 120, and for the month of October, it's been about 100. But like the sun that peeked through the clouds this morning, it isn't all gloom. The Allegheny County Health Department is ready. We anticipated this increase in cases, and we spent the summer preparing. We hired and trained a team of case investigators and contact tracers. We've refined their methods and built in increased surge capacity so we'll be able to stay on top of the cases here. And as I've said many times, it's important to have the availability of more testing as our case numbers increase. In the health department, we continue to work to expand access to testing in partnership with our federally qualified health centers, or FQHCs for short, and groups like EMS and others. To date, our federally qualified health centers have performed nearly 23,000 COVID tests at their offices, off-site, and in a wide variety of locations. Whenever there's been a need in the community for targeted testing, our FQHCs have been there to meet that need. Most recently, they joined forces with the Pennsylvania Department of Health and faith-based organizations in our community to bring more testing to community locations. Upcoming events at faith-based locations are being shared on our social media accounts. And we continue to host the community test site in McKeesport in collaboration with the Pennsylvania Department of Health, the Pennsylvania National Guard, and many other helpers. The test site has evening hours tonight and tomorrow, and we are open this Saturday as well. Again, I want to remind everyone these tests are free. Insurance is not required, and you do not need a prescription or a referral from a doctor. So we also continue to keep a very close eye on our long-term care. At the health department, we're extremely appreciative of the Regional Response Health Collaboration Program, commonly known as RICP. The work of the RICP teams at our long-term care facilities really has been fantastic. They've helped the facilities be better prepared and equipped to handle cases and to take steps to prevent large-scale outbreaks. And I am certain that their work has saved lives in our community. Everyone who's worked with the RICP program has stressed how beneficial it's been. We continue to monitor data closely for cases, clusters, outbreaks, and when we identify increases in cases among a particular community or group, we are trying really hard to tailor our responses appropriately to that need. So for example, when we identified an increase in cases among our Asian populations in the South Hills, we partnered with groups, organizations, and individuals in the community to identify opportunities to help. We shared information and resources, we had specific information sessions, we sent out teams to do educational visits, and we arranged for targeted testing. The community welcomed these efforts, and we are pleased to see the spread of COVID is beginning to slow in these communities. Slowing the spread of the virus is particularly important now, as we have many upcoming holidays, events, and festivals planned in communities across the county. I want to remind everyone that there are ways to celebrate safely, but differently, including staying outdoors whenever possible, staying physically distanced, wearing masks, and keeping your groups small. A challenge we face now is that our data and case investigations indicate that there is not a single, even just a few sources of transmission of the virus. There are many. The virus is spreading throughout the county. It's being spread among private parties, both small and large, workplaces, school groups, and restaurants. It's in most of our neighborhoods and municipalities. We know that we can keep our economy open and safe, but in order to do so, we need to continue with our universal strategy to contain the virus. The former CDC director, Tom Frieden, and his team coined the term "box it in." It's an approach to controlling the pandemic. We have been using this approach here in the county, but we need your help. So I'm going to describe what that box it in means. It has 4 steps or sides like a box. The first side is test widely. We need you to get tested if you have symptoms or are a close contact of a case. We have many testing opportunities in the county, including through our great healthcare organizations, our urgent care centers, pharmacies, the FQHCs, and our testing site in McKeesport. The second side of the box is to isolate all infected people. Again, we need your help. If you test positive for COVID-19, we need you to isolate. It's important to keep those with the virus away from others to stop it from spreading. Regardless of our case numbers, we try to reach every case, and we've been very successful at nearly reaching all of them. To continue this effort, last week we activated some of our surge case investigators to stay on top of the cases, and we continue to do so to box in the cases and minimize the spread. The third side of the box is find everyone who's been in contact with a case. It's important to find the people who may have been exposed to the virus and get them tested too. Again, we need your help. If you tested positive, we ask that you please share the names of your close contacts with the health department when we call you. Finally, the fourth side of the box is quarantine all close contacts. If you're identified as a close contact, we need you to quarantine for 14 days and get tested. Recall, many people who are positive for COVID-19 have no symptoms and can be spreading the virus without knowing it. To aid in this process, please download the state's COVID Alert PA app, which can help identify those who may be a close contact and aren't aware. So with your help, Allegheny County can box in COVID-19. We've heard from the community about the challenges of isolating or quarantining, whether for adults or children. I know this is a burden and hardship for many. Some people fear losing their jobs or falling behind on bills. I know there are parents who don't want to take their children to be tested because they can't stay home with them if they're positive. I know this is extremely hard. Help is available. Please call 211 and they can connect you to resources for people who are in isolation and quarantine. And remember to help one another if you can. We are stronger when we work together. So thank you for your time. Please stay safe and be kind. Thank you.
We only have had 3 questions submitted today, and 2 of them were covered in your remarks, so I just have one question for you. It's from the Pittsburgh Business Times. How safe is Halloween for kids and their parents and caregivers, and how safe is in-person voting?
Okay, so I think I've said this the past couple weeks. I think Halloween can be done quite safely for people. Again, it's the same rules we talk about all the time. Halloween is outdoors, which is safer than indoors. So when you have your celebrations, keep them outside. Go in small groups, don't go in large groups. Wear a proper face covering, a mask. Eat in addition to whatever decorative Halloween mask people are wearing, they still need to wear a proper mask. They can use hand sanitizer frequently and limit your interactions with people to just brief. So I think all of those things, again, should keep people safe with Halloween. In terms of voting, you know, the county has really planned incredibly well. There's going to be spacing for people to stand separately. There's going to be hand sanitizer there. All of the workers at the polls will have face coverings on appropriately. Again, it should be absolutely safe if people follow the recommendations and the guidance that our county executive laid out at the beginning. So again, I think it is safe if people follow those general guidances.
Just in the nick of time, a question from the Post-Gazette. Is there any one age group that is represented in the new cases?
We have seen, in terms of cases, no, they really range across the entire age range. We've been looking to see if we see any particular trends, but really at this time, no big changes.
And that was the last question. If there's any closing remarks.
Thank you.
Thank you, Dr. Bogan. And again, as mentioned, the voting, we were very successful in the spring primary, in which over 100,000 people did show up in person to go and vote. And my recollection is there were no cases, either from the poll workers and or the voters who were there in election. Now, we're going to expect a bigger turnout. We might have as many as 300,000 people who show up at the polls on November 3rd. But again, if the operation by wearing your masks, keeping distant, following the guidelines on the floor, standing at where the tape has you going, et cetera, the poll workers, we can do this in a very safe manner. But that and every other operation that we've been learning about, how we can do it if we're wearing our masks, if we're keeping distant and using hand sanitizer and doing the things that we need to do. So everybody, please have